And now my research aim is to collaborate with communities and decision makers to generate rigorous evidence to inform sustainable nutrition policies and interventions to improve children's health. So my approach uses a strategic science model that basically is a framework that tries to address the gap between what we as a researchers say and what the policies and interventions can be adopted. So the first step of this is not like something super special, but I think that really helps to make sure that our research is relevant and can inform policies. So for the first step for this is to connect with change agents. So that could be people that have influence over policies you care about, or implementers, or lawmakers, or advocates. Then with them, we can develop strategic questions, like ask them like, what research do you need to inform specific policies or problems that you really care about? And then you use your research to answer those questions and then communicate the information, not only in the academia, but in different ways, so that can really be translated into policy. So I'm going to provide like some examples of how I'm using like this strategic model. Um, and as I mentioned, my research tried to address multi-level factors to shape child nutrition. So one of them is the commercial determinants of health. The other one is like the school environment where the children spend most of the time. And the third one is the home environment. For this presentation, I'm going to talk only for the commercial determinants of health and the school environment. The home environment is an ongoing study that we have right now, so we don't have results now, but probably maybe later I can get invited to present these results. But talking about the commercial determinants of health, first I want to tell you a little bit about what is commercial determinants of health. So commercial determinants of health is basically a way to study how the private sector activities can affect people's health. So one way that they can do this is by lobbying. For example, when corporations lobby against health policies like taxes or nutrition standards, marketing restriction, etc., that could affect their profits. The other one is shaping the evidence. So it's when commercial actors shape how the diet or health problems are framed. And that could be by funding research or promoting narratives of personal responsibility, for example. And a third example is when companies aggressively market unhealthy products. And that could be very specific to children or vulnerable communities. And that way they try to normalize harmful consumption of these products. So my study in commercial determinants of health that I'm presenting now is about the food and beverage industry interference in science and policy, and we use the soda tax in Mexico as a case study. So as a background, Mexico passed the soda tax in 2014, and at that time, Mexico was the largest soda consumer in the world. So in average, the Mexican population was consuming about 80 spoons of added sugar only from sugar sweetened beverage per day. So that just the sugar sweetened beverage exceeds the limit recommended by the American Heart Association, that is no more than 60 spoons of added sugar. So it was not surprising that at that time, 1 in 3 children and 2 in 3 adults had overweight and obesity, and about 15% of adults had diabetes. So that's why one of the policies that Mexico tried to implement was this soda tax in 2014. And there were at that time a lot of evidence about how the industry interference, what was doing the industry before the implementation to prevent the passage of this. But there were not that much information about what did they do after the implementation. So we connect with change agents that were from the El Poder del Consumidor, which is a non-profit organization in Mexico that was a really champion on promoting the soda tax in Mexico. So they did like a lobbying, but also did a lot of campaigns to create awareness about the problem of the soda consumption in Mexico and make the community to be aware and also in favor of this soda tax. And we also connect with academics from the National Institute of Public Health that were champions on providing the evidence to show that the soda tax was needed. So with them, we decided to develop strategic questions. And that was like, okay, what are the strategies used by the food industry to discredit the policy after the soda tax was implemented in Mexico? So what we did was to review internal food and beverage industry documents that these documents are in the UCSF Food Industry Archive. That is like a kind of like a browser where you can find for internal memos, emails, and private communications from the food industry. We triangulate this information with publicly available sources, and we did a thematic analysis, chronological and thematic analysis following the policy dystopia model. So the policy dystopia model is a framework that describes how the corporations shape the debate and policy decisions, promoting negative narratives about the policies that they care about, or using different instruments like political, legal, or other tactics to slow the adoption of different policies. So what we found with this was that the food industry paid scientists to evaluate the effectiveness of the soda tax. So there were like some, this industry funded, but we also look at the non-industry funded to see like how different was the discursive arguments between these two. And what we found was that the industry funded studies argue that the soda tax make job losses, about 10,000 of job losses, in compare the non-industry funded found that there were no change in unemployment. In governance, the industry-funded studies argued that the policy was regressive. That means that this policy was going to harm more the low-income populations because they have to pay more for a soda tax that was a higher percentage of the budget. While the non-industry funded studies argue that the policy was in fact progressive because those low-income population are those that have a higher consumption of sugar-sweetened beverage, and they had a higher reduction of that consumption after the soda pass. And also, the industry-funded studies framed the debate saying that the soda was not associated with change in sales, and that there were no change in obesity and diabetes. But they did this evaluation on obesity and diabetes just 6 months after the soda tax passed. So the non-industry funded studies found that the soda tax was actually associated with a decrease in sales of sugar-sweetened beverage, and they recognized that it was too early to evaluate a change in obesity or other non-communicable diseases. So they made projections to see how that will be affect in policy in health outcomes if that policy continues with the same decrease on sales. And they found that there will be a decrease in obesity, diabetes, and cardiovascular disease. So after the soda tax happened in Mexico, there were a lot of interest in other countries to have like similar policies. In the US, there were also some states that they were trying to pass similar policies. And what we found was that the industry was very interested to disseminate these results from the industry-funded studies to argue that this soda tax in Mexico was not working. So they share these studies with journalists. This is a script from one of the emails where you can see that they share these industry-funded studies with the Wall Street Journal, and saying that they review multiple studies from well-respected institutions in Mexico, supported funding from the industry, and that they make clear that the tax was ineffective. And then they also, what we found is that the executives in Coca-Cola also shared this with the executives in the communications and government relations and the Global Pacific leadership team. So that was like something that happened in Mexico. These studies were disseminated everywhere to make sure that similar taxes didn't happen in other countries. So this is another quote from another paper that from another email from Coca-Cola executives that says that please find attached relevant and useful updates of the excise of the soda tax in Mexico to engage with the stakeholders to demonstrate why these taxes are not effective. And then something that happened after was there was going to be like a high-level meeting from the UN, and ahead of this meeting, they create like this report that is the World Health Organization Time to Deliver, and that this document outlines the best buy policies to reduce the burden of non-communicable diseases. And in emails between Coca-Cola, they recognized that this was the most important event ahead of the non-communicable diseases field. And what we found is that in the first draft, they recommended soda taxes, but in public comments from the International Council of Beverage Association, they argue against that, saying that the non-industry funded studies that were used as a reference to say that the soda tax was working in Mexico, they say that this study showed no impact in obesity or rates in Mexico, and the authors were relying in theoretical models. That was what I was telling you about these projections that they did. So at the end, in this report, they did not recommend the soda tax. However, now, almost 12 years after, we have seen a really high uptake of the soda tax in different countries. Now, about 83 countries have a soda tax, and 17, there is also 17 subnational soda taxes, like in cities or specific counties in other countries, like, for example, here in the US, that is in some cities. So then, the fourth step for the strategic science model is to communicate this information. So we publish an academic paper, and in the supplementary material, we provide the translated paper. So people from Latin America and Mexico could have access also to this information. And we share with our change agents, like El Poder del Consumidor, to make sure that they could use this information when planning different other policies. Okay, so now I'm going to move to the second study that is in the school environment. So we talk already about like how the food environment is important. Now we are going to go to a smaller level that will be the school. And for the school, we conducted a study to reduce ultra-processed food in school meals, and we wanted to evaluate what was the barriers and facilitators from the school food service director's perspective. And as many of you know, I think that many of you are a dietitian or are very informed in nutrition, so there is like a lot of interest now in ultra-processed foods. But what is ultra-processed food? Are basically industrial products that has ingredients that we don't have in our kitchen and are usually high in sugar, sodium, saturated fat, and calories. And the best way to classify the foods is using the NOVA classification system that classify foods in 4 groups. That is the minimally processed or unprocessed, culinary ingredients, processed food, and ultra-processed food. The minimally processed will be things that are like in the natural form or has like a minimum process that doesn't really affect the quality or the content of the food. And one example could be corn. The processed culinary ingredients are the the ingredients that we use to cook. That could be salt, oil, butter, sugar, etc. Processed food is the mix of these two. So that could be like canned food, like for example, tuna if only has tuna, salt, and water. It could be meat when you cook it and add salt and oil, or bread when it's from the bakery without any additional ingredients or cheese. And ultra-processed food, that is the one that we really care about, is the food that doesn't look at all like the natural form and has like a long list of ingredients that we don't recognize and we don't have in our kitchen. That could be artificial colors, flavors, emulsifiers, etc. So one example of that will be Doritos, that doesn't look at all like the corn and has a very long list of ingredients that we don't have in our kitchen. When this idea of ultra-processed food came in the academia, we were thinking that was mostly because these products had a low nutritional quality. That means that they were high in saturated fat, sodium, and added sugars. But then more evidence came, and this we identified that it's not only about nutrients, but there is also something else that is making this to be less healthy. And one very known study is from Kevin Hall, where he did a clinical trial to evaluate the consumption of ultra-processed food versus minimally processed food or processed food. And they did this clinical trial with 14 participants, and they gave them 2 weeks processed food, ultra-processed food, 2 weeks minimally or processed food, and then they switched the groups. And what they found was that the ultra-processed food have an average of 500 calories higher consumption per day, and there were an increase in body weight, fat mass, and fat-free mass. So that gave us an idea that it was not only the nutrients of concern, because these diets were matched in the nutrients, and there was something else. And now, like 10 years later, there is more than 100 studies that have shown that there is an association between ultra-processed food consumption and different health outcomes, including diabetes, obesity, dyslipidemias, hypertension, etc. And how is the consumption of ultra-processed food in the US? So the highest consumption, you can see that is in school-age children, that 2/3 of the calories that they consume comes from ultra-processed food. So maybe the school meals is a unique opportunity to reduce ultra-processed food consumption. Why? Because it serves about 30 million children in the US and provides up to half of the calories that children consume every day. And also, children that experience food insecurity are more likely to participate. So the school meals now, we could argue that it's the healthiest food that most children eat every day because has to meet different nutrition standards. It has limit in calories, in fat, in salt, in sugar. It has to provide fruit and vegetables, whole grain rich, and milk. However, this is an example of the school meal that my son gets. And as you can see here, it meets all the nutrition standards, but everything here is ultra processed except the cucumber. So how can we transition how can we transition to minimally processed to ultra processed food in school meals? Now there is a lot of momentum to try to identify how can we do this transition. For example, in California, in October, they just passed the Real Food Healthy Kids Act that mandates to phase out harmful ultra-processed food by 2035. So there is momentum there, but we just need to understand how can we make this transition. So we connect with change agents. We have this partnership within the community, academic, and policy that is from Stanford, that is like the research group, the policy, the policy advisors that are from UC and PI, and the community that we have working with two community-based organizations, that is Dolores Huerta Foundation and Cultiva la Salud. So we developed strategic questions, and we were trying to identify how, if we use a community engaged approach, what will be the barriers and facilitators to increasing scratch cooking as a strategy to reduce ultra-processed food in school meals. And we also connect with more change agents. We create a community advisory board where we included officials from the California Department of Education, the California Department of Food and Agriculture, nonprofit organizations that works very closely with schools, and also with food service directors. And they help us to identify like what will be the best design for our research, what we want to ask to the food service directors, and also they help us to identify what will be the policy and practice implications of these results. So we conducted 20 semi-structured interviews with food service directors from school districts in San Joaquin Valley. We focus on San Joaquin Valley because it's where our partners are located, but also because it's an area with higher low-income communities, and there is the highest prevalence of food insecurity and diet-related non-communicable diseases in California. We identify food service directors and interview food service directors from rural and urban districts, and also those that were awarded with the Freshly Prepared Meals Grant. This grant was from the California Department of Education and was they give additional money to food service directors that attest that at least 40% of their meals were freshly prepared. So include food service directors with this grant and without this grant to have more variability in how each district were doing with scratch cooking. So in the interview guide, we ask about barriers and facilitators to reduce ultra-processed food and increasing scratch cooking. We did a hybrid thematic analysis guided by the socioecological model, and we followed the correct qualitative reporting standards to ensure rigor in our study. We found four main themes. One was related to food procurement. The kitchen equipment and infrastructure was another theme, budgeting and funding, and staff capacity and training. For food procurement, it was what we found was that there were challenges in accessing fresh produce. That was surprising for us because it's in San Joaquin Valley where there is a large agricultural community. And having them telling us that they don't have access to fresh produce was a really interesting finding. And also we found that most of the districts rely to the USDA food processing program. So what happened in the schools is that the USDA provide food to the school districts that is a much lower price than if they get it from outside. And most of this food is minimally processed. So could be like raw chicken, grains, maybe canned fruit and vegetables. But the USDA also have this program that is the USDA food processing program. And this program, what happened is that the USDA approved some food processors, and the district can decide instead of getting the raw chicken from the USDA food, they can send it to these food processors and get ultra processed food. So, for example, they can send the raw chicken to Tyson and then get chicken nuggets from instead. So with the CAF, we identified some recommendations, and one was to strengthen the farm-to-school programs and maybe create regional food hubs that could connect local farmers with schools to have more access to fresh produce. And then the USDA food processing program could prioritize local food processors and incentivize the change to less processed food. For kitchen infrastructure and training, we found like the state in California helps update kitchen infrastructure and equipment. They have a lot of grants, like a specific one that is the kitchen infrastructure and training, that provide funds to the schools to buy equipment and kitchen. And what we found is that the funding use varies between districts. We found like some districts that were able to upgrade their kitchen to really do more from scratch. Like they bought ovens and a lot of equipment to really be able to cook. While other school districts just bought more ovens to continue the heat and serve practices. Also, we found that there were some districts say that, okay, we got all this money, but we don't have a kitchen or we don't have enough space or the infrastructure to really upgrade our equipment. So our recommendation was to provide technical assistance alongside with funding to better use of the resources. So they are giving all this money to each district. So maybe they will also need to have like more technical assistance and identify how can they improve and better use this funding. For budgeting and funding, we found that the districts have okay, in 2020 during COVID, there were a universal school meals. That means that every children have access to free school meals, no matter how was the income of the family. And that continued in California until now. It became permanent. And that was something that really helped the school districts because that increased participation and means that they could have like more budget to buy different food. However, they also rely on different grants. Like they have to apply to grants, like also as a researchers, to get money to buy food and serve food. So that uncertainty about don't know if they will have like this funding the next year or not will make them hesitant to make some changes, more permanent changes. And also, they mentioned that they don't have the time and capacity to really go for these grant opportunities. So the recommendation was to increase the federal and state reimbursement rate per meal, and also provide grant writing support and simplify the applications and reports so they don't have to really spend that much time asking for these grants. And then for the staff capacity and training, what the food service director was saying is that there were a lot of staff shortages and part-time staff. Many of the districts rely only in part-time staff, so they don't have the time to really sit and cook. Like some of them go in the morning to serve breakfast and then come back for lunch to serve lunch, but they don't have that time, that staff time to really cook. Also, they were concerned that the staff doesn't have cooking skills and that they were concerned about if they don't cook well the food, then they could be like food safety concerns. Some food service directors also didn't have any nutritional training, and it was hard for them to trying to meet the USDA regulations. So no, making sure that they are meeting the standards in salt, sugar, etc. It was going to be harder if they have to do everything from scratch. And then some of them mentioned that they were having like some training, especially from the School Nutrition Association. However, the this training, this kind of trainings that they have in the School Nutrition Association is highly funded by the food industry. So this is an example of webinar that they provide, and you can see it's like the role of nutrition and culinary education in driving healthy behaviors, but that was funded and presented by Kellogg's. So if you get the training from the food industry, you won't expect that much change into more scratch cooking. So our recommendations was to increase funding to hire full-time staff, but also provide training free of conflict of interest for food service directors and staff. And we are in the process to communicate this information. We have two papers on the review, and we are finalizing policy briefs that we are going to share with our networks that could help inform the AB 1264. And we also create like fact sheets for the school districts. Okay, so as you can see, like we have like these three different levels. I talk about these two. This one will be pending. But in summary, about the commercial determinants of health, what we found here is that the soda tax in Mexico shows how the corporate interests could influence nutrition policies. And us as a researchers or dietitians or everyone that is working in nutrition should be aware of conflict of interest. So make sure to always look when you are reading a paper that who funded that study so you can have more critical thinking and if possible avoid receiving funding from the food industry. And for the school environment, we identify some barriers, but also we identify some recommendations that could help the transition to scratch cooking and inform the implementation of the Healthy Food Real Food Healthy Kids Act from California. So I want to finish this with a story about my vision. So when the very first time that I got into a plane, I saw these lights in the airplane, and I asked my mom what does this mean? And she told me that before people used to smoke in the airplanes, and when this light turn on, that means that you have to turn off your cigarette. So I was shocked, like how is possible that people were smoking in the airplanes? Like doesn't make sense, right? Like how is possible that? So my vision is that when I tell my son that half of the food that children were eating every single day was mostly ultra processed food, he will be as shocked as me because now we have a policy and practices in place that protect children from this. So we will have healthy school meals, we will have a healthy food environment, and also we will have access to healthy food at home. So finally, I want to thank my mentors, collaborators, students, our community partners, and also the funders for this research. So I'm happy to take any questions.
Thank you so much for a wonderful presentation. We do have a few questions.
Yeah, thank you so much for the presentation. It was really interesting. I had two questions. One relating to the commercial determinants of health. You talked about how the results from the industry-funded studies differed from the ones from the non-industry funded studies. Could you talk a little bit about how the methodology and the approach of these studies differed, and why they found different conclusions? Like, were there difference in the types of methods they were using? And then I was also curious when you were talking about the California ultra processed food law. My understanding is for the first 1 to 2 years of the bill, they'll be working on creating a list of what the ultra processed foods are and defining the criteria. So can you kind of, if you're able to shed some light on like what's the conversation happening about how to define, the UPFs and yeah, some of that. Thank you.
Yeah, thank you so much for your questions. So for the first question about how the different were the studies from the industry funded and non-industry funded, that's a really good question. Um, I I will need to get back to all of them, but one of the main difference, for example, in the sales one, what that happened is that the non-industry funded was not adjusted. It was like the raw sales of soda. So that showed that there were no change, or the change was, I think it was like 6 milliliters or 6 calories. I can't remember the exact number, but they argue that that was like so minimal that won't have any effect on consumption. The non-industry funded, they did like analysis adjusting for um, I well, for different variables, but the main thing was for the growth, the population growth. Yeah, sorry, I just missed that word. For the population growth, and that they found like there were a decrease per capita in soda consumption. So I feel like the non-industry funded were more rigorous compared with the non-industry funded. And something that happened was that the non-industry funded were not peer review. They published the reports right away without any peer review. And as a policymaker, you don't see the difference between a peer review versus non-peer review, and they use it in the same way as a paper that will take longer. We know how long it is to get one paper published. So that was like one of the main difference between the non-industry and the industry funded. For the health outcomes, I don't remember the methodology from the non-industry funded, but it was also change in obesity, and that also you don't expect to see any change in 6 months after the implementation. That will take longer time. So that's why the non-industry funded is like more projection models to identify how much will be a decrease in obesity over a certain period of time. And then for the second question about the the AB 1264, that's a really good point, that how the what will be like the definition of ultra processed food. So for a start, this legislation use a different definition of ultra processed food. The one that is used in almost everywhere is the NOVA classification, and what the AB 1264 did was to use a more limited definition that requires to have like food additives, but also be high in salt, sugar, fat. So why they did that? because they were concerned that if they use the NOVA classification, then everything will be ultra-processed and will be harder for them to implement. However, it's going to be very interesting to see what is going to happen next, because what we have learned from other countries is that when they limit added sugar, fat, and salt, they will just reformulate. And we will have now food probably with lower quantities in nutrients of concern, but will still be ultra-processed in schools. So we will need to see how this will want to change. And also, they have to define what will be ultra-processed food of concern. And we don't know exactly what will be that result, but what I think is going to happen is that they will focus with specific food groups, like maybe processed meats, sugar-sweetened beverages that are already out of schools, and other specific groups that also will limit the amount of ultra-processed food that really will be out of the schools.
Thank you.
Yeah, thank you. Very interesting presentation. I do have two questions. So the first one, in this pipeline, especially in moving on from, I have some UPF in the school lunch, and then now having more minimum process. Is there would be any measure to assess the acceptability among the students? When we substitute the ultra processed food products with the minimally processed. And then my second question is about the cost. Is there any measure to compare the cost between providing minimally processed foods as a lunch? I believe there's some consideration on like food safety that have to be taken, which adding more cost, but how that compares to like providing the ultra processed foods. I'm curious about like whether the costs would be lower with the minimally processed. So yeah, those are my two questions.
Thank you for those questions. About the acceptability of the school meals when it's less processed, we also conducted focus groups with students. And what we found there is that most of the students will be happy to have like more homemade meals, how they mention it. We in some students also mentioned that like when they go to get the school meals, like if they are the last on getting the meals, they don't have like the same food because all the fresh food are already finished. So they have to bring more heat and serve products like chicken nuggets and things like that doesn't fill them out. There is also another study from UCNPI where they also found similar results, like students really prefer fresh food. One of the food service directors that we interview, I think that could be like a case study of success. They made like an amazing job on doing like all this scratch cook. He has a background he's a chef with background in nutrition, so that was like a very specific person. But what they did to increase the acceptability was a lot of engagement with the parents and students. So they had chef competitions with students designing the menu, and then the winner was in the school menu. They had workshop with parents to learn to cook healthy and low cost recipes, etc. So they have like a lot of engagement that really helped to the acceptance of less processed food. So I think there is an opportunity there. And then the other question was, I forgot, sorry.
About the cost.
The cost.
Yeah.
Yes. So there is like some analysis that have shown that since like the cost of minimally processed is less expensive than ultra processed, if you like per meal, what it increase the cost is the staff, yes, like the staff to cook the meals. So but at the average will be like the same, and there is also some that will show that could be like cost effective, because in the long term could also if it's even a little bit more expensive, in the long term will save a lot of money in preventing different health outcomes. So it's just like the first investment, what is going to be the hard part. But once it's in place in every school, it will be like more cost effective, I think.
Thank you. There's a question online.
Hi, Steve Bosti from Ag and Resource Economics. Thanks very much for your very nice presentation. Related to the last question, every single one of the suggestions for action included increased funding. Which stakeholder groups should be called upon to cover those costs? Is this national? Is it state level? Is it local? Or how have you looked into what's the most effective way for raising the resources among these different stakeholder groups to get your agenda implemented?
Yes, I think that that's like the the million question because I don't know exactly who can really bring this money and will require it to be like a combined effort. Like for example, the reimbursement rate. What happened is that the federal government gives specific money per meal that is served, and California supplement that with to adjust for the cost in California. So having like the increased reimbursement rate both at the federal and state level could really help that. So that will be like a combined strategy. But also we know that we will have a lot of upfront costs, like having like the kitchen, etc. So that will be like a highest investment. In California is doing that with the kitchen infrastructure and training grant that they give millions of dollars to schools to really do that. But they also keep this challenging on how to really use that money in the best way. So I think that it's a combined effort, but the easiest way will be to go local because, for example, California is leading all this effort. So if we do a really good job in California, other states will be able to follow what California is doing. So I think that the momentum is right now a more like a local level in California.
If I could follow up on that, you suggested local in your mind means California. Is there a more local, school districts and counties who are, the ultimate beneficiaries of these? Is there scope for kind of more local taxation schemes or other kinds of resource generation to cover some of these costs?
That's a really good point. And I think that there is like a room for that. However, since you will expect that like the districts with more resources will be able to get even more resources, that could really increase like these disparities between like high income districts versus low income districts. So that will be the challenge there, I think. But yeah, definitely the local at the district level could really help as well.
I have a question. I was just thinking about different schools. Like some schools might be smaller or older. And one of the recommendations is like upgrading the kitchens. And just have you looked into maybe if there are some school buildings that can't be upgraded, and then if there's an issue where some schools are able to serve like more scratch meals or better scratch meals compared to other schools that might not have that infrastructure.
Yes, and I think that's still a challenge. Like we found that also in our results, like if they don't have like the space or the real infrastructure to do these changes will be like more challenging. Other districts, what they are doing is that instead of having like a kitchen per school, they build a central kitchen. So that way they can like cook everything from scratch in a central kitchen and then deliver to all these schools that they don't have the infrastructure. So that could be also another way to solve that problem. But again, everything comes down to money, and we will see how much will be available to make all these changes.
Thank you. Very interesting. Any other questions? All right. Well, we are close to time. Thank you again for joining us and presenting such a wonderful topic. Lots of engagement. So thank you all. Thank you for joining online as well.
Thank you so much. Have a good day.